Guru Nation, don't quit your day job. So, just did a long podcast, not a long one. They're all about 20 to 30 minutes. Episode 70 on random musings from the Clinical Trials Guru. Shameless plug. Or you can check it out on YouTube here. Don't know why I'm doing this. But basically, in a nutshell, don't quit your day job. You can own a research clinic and have a full-time job. It's not recommended long term for your mental sanity, amongst a whole bunch of other things, but it's possible, and I argue, it's necessary in your first year, 6 months to a year, because you don't know. Okay, you want to reduce, you want to mitigate risk, and the best way to do that is to have options and have backup plans. So don't quit your job. If you're a CRA and you're itching to start a site, you might be onto something. There's a lot of people in your boat, same boat as you, doing it. You probably don't know about it, but they are. I know about it because a lot of them are my clients. But there's different strategies. But I always instruct them to not quit their day jobs, have backup plans. You'll know when you need to quit your job, and it's not as soon as you think. Okay, so just because you open a site doesn't mean that you're going to start getting studies and start getting income right away. So don't quit your day job. That would be foolish. Always have backup plans. And if you realize that your site is not working out, maybe your PI left you, maybe your PI started his or her own site and stole studies from you, or you just don't like being a business owner because it does get stressful. Well, yeah, 90% of businesses fail. You'd be happy that you didn't quit your job because you have income, you have a plan B, and always have plan Bs, always have backup plans. On vice versa as well, if you don't have any research experience and you start a research clinic, that's great, but try to get some kind of experience from outside of your own company, maybe as a study coordinator somewhere, or maybe as a consultant. Go on clinicaltrials.gov and just start pitching people for consulting opportunities. You should be doing that for studies anyways, but pitch them for CRA gigs if you can, for trial master file positions if you can, entry-level positions, just so you can start building up your CV, because you're also taking a risk. Unless you have experience in another industry that you can fall back on, you can do it. But if you want to gain experience in this industry, you can do it simultaneously. In your first year, you're not going to have that much activity, especially in your first 3 to 6 months. You're not going to be that busy, so you could pull it off, and you can build up your CV while building your clinic, and then you'll know when that inflection point comes, when you need to quit and dedicate into one endeavor. Focus, the acronym, focus on one course until successful. That will be the long-term strategy, but when you're just starting out, risk is at its highest, and you want to mitigate that risk in all possible ways that you can, and that means don't quit your job. That means if you're starting a site and don't have research experience, try to get a job somewhere, even a part-time job doing something, so you could build up your CV, build some experience. On top of that, you can learn what to do at your research clinic. Just be transparent with those people. Let them know that you have a research site. You don't want to go work for a competitor and then start your own clinic. You can get sued for that, actually. But the point is to build up your experience, to have a backup plan, to have an insurance plan in place. Another benefit of owning a site, if you don't have any research experience, is you can, if you ever, let's say your business goes out of business in 2 years or 3 years, you basically have experience working for yourself, right? And you can then translate that into getting a job in the industry. So backup plans are great. Always be thinking about it. Yes, you have a plan. Yes, you have a goal. That's great. But mitigate risk, especially in that first year. Entrepreneurship's not for everybody. 90% of people fail. Mitigate risk. Be careful, Guru Nation. Let me know if I can help. All right. Talk to you soon. Bye-bye.